Hello, nurses. Oh, okay, nurses, we're going to talk about barbiturates and benzodiazepines. These are sedative hypnotics. These are drugs that need to be used with a good deal of caution. Let's start with the barbiturates. These, again, as we said, are sedative hypnotic medications. They work in the central nervous system. They suppress activity in the central nervous system. So they're used for seizures, insomnia, to calm people down before any sort of procedures, operative procedures. They're also used for migraines and to treat increased intracranial pressure. To recognize a barbiturate, the ending will either have barbital at the end, B-A-R-B-I-T-A-L, or they will have I-T-A-L at the end of their names. So a silly mnemonic for this drug is to remember that these are the drugs written in italics, because ITAL kind of looks like shorthand for italics. So if you think italics, think barbiturates, those will help you recognize these drugs. Barbiturates have been largely replaced by benzodiazepines. They have no antidote and they have a narrow therapeutic window. For that reason, they're being used less and less. Having said that, they do have their uses. So phenobarbital is a drug you'll see the most. That's used for seizures. It's used briefly as a sleep aid. It's also used for anxiety, and it probably gets used the most, excuse me, for increased intracranial pressure. Pentobarbital is used in veterinary medicine, used mainly for euthanasia procedures. Secobarbital is a preoperative sedative. Utabital is a drug that's used for migraine headaches, typically in combination with acetaminophen. Methotrexate is used as an anesthetic. These drugs work at the GABA A receptor. So this is the gamma aminobutyrate, gamma aminobutyric acid receptor. It binds the neurotransmitter GABA. When it binds GABA, it opens and allows the passage of chloride ions into the neuron. That hyperpolarizes the neuron and makes its action potential much less able to happen. So these turn down neurons. They turn down neurons, they prevent neurons from being activated. That's why they use as sedatives. That's why they're used as anti-seizure meds. That's why they're used as anxiolytics, because they tend to cause hyperpolarization of cells. So when barbiturates bind to the beta subunit, They tend to cause the GABA A receptor to be open for a longer period of time. So they increase the influx of chloride ions into neurons. They increase hyperpolarization of neurons and prevent stimulation of neurons. At high doses, barbiturates can bind to the GABA A receptor and cause the opening of the receptor in the absence of gamma amino butyric acid. That's the case at high dosages. That's not the case with benzodiazepines, but that is the case with high doses of barbiturates. So as we said here, these GABA A receptors are found throughout the limbic system. They tend to decrease activity. They then tend to turn down the central nervous system. They potentiate the effect of GABA, but at high doses, they can act without it. And they act essentially as depressants of the central nervous system. So for the nursing responsibilities for barbiturates, remember the mnemonic barbits. Barbits. So for B, for barbits, means that they act at a site on the receptor other than the neurotransmitter. And at high doses, they can essentially work in the absence of GABA. These drugs also have a narrow therapeutic window. A, these drugs have a high potential for abuse, for addiction, and dependence. So you need to ask your patient, do you have a history of substance abuse? That'll be in their records. Do they have a history of suicidal ideation? Have they shown drug-seeking behaviors in the past? These are all things you need from a medical history. R, recognize the signs of overdose. Does the patient require mechanical ventilation? Respiratory failure is one of the main signs of barbiturate overdose. The patient may also require activated charcoal to purge the drug from their body, where they may need dialysis. So the signs and symptoms of barbiturate overdose can be remembered by the mnemonic lethal. L, loss of consciousness. E, eyes will be pinpoint and then they'll dilate and be fixed as the body starts to shut down. T, tachycardia. H, they will have cold, sweaty skin. A, they will be absent of reflexes. And then L, they'll have low and shallow respirations. B, be aware of patient safety. Patient will be very relaxed and euphoric. They won't be able to think clearly. Their senses will be dulled. They will need help getting up. They're a falling risk. Make sure you put the belt on them, keep a hold of them. Make sure their bed is not too high so that they don't get out of bed and then promptly fall on their face. They're to make no important decisions or drive or operate heavy machinery while on these drugs. There's a risk of accidental overdose. So take the drug as I instructed. Take the drug as instructed. Do not mix barbiturates with other CNS depressants. Don't mix them with opiates. Don't mix them with alcohol. And they have a low therapeutic index. So measure drug levels of barbiturates. Here's a set of lab numbers you should remember. Phenobarbital levels should be between 15 and 40 micrograms per milliliter. 15 to 14 micrograms per milliliter. T, tolerance, because a patient can no longer get the same therapeutic bang from their prescribed buck, their prescribed dose. They'll give themselves a little bit more, a little bit more, a little bit more. That can lead to accidental overdose. It's most common with long-term use of barbiturates. And then S, don't stop the drug abruptly if they've been using the drug long-term. That can lead to withdrawal symptoms. Withdrawal symptoms can be remembered with the mnemonic craves. C, convulsions. R, restlessness. A, agitation. V, vomiting. E, elevated temperature. S, sleep problems. These can be severe. They can lead to shock and death. So always step the patient off barbiturates if they've been using them for an extended period of time. Next, let's go to benzodiazepines, another set of sedative hypnotics. So these are also CNS depressants. They are anxiolytics, they're sedatives, and they're hypnotics. Some are potent, some are less potent. Some are long-acting, some are medium-acting, some are short-acting. So here's my pop culture reference to remember the short, medium, and long-acting. Short Tom, medium cat, long divorce. So you remember Tom Cruise was married to Katie Holmes, his first marriage, and Tom Cruise is quite short. Katie Holmes is medium height. You could see here in this picture, she's actually taller than Tom Cruise. Their divorce was very long and drawn out. So short Tom, medium cat, long divorce. Okay, I know it's stupid, but you remember it. Now to recognize benzodiazepines, look for ZE or ZO in their names, or look for drugs that end in LAM or PAM. So clorazepate has ZE. Chlordiazepoxide or chlordiazepoxide has ZE. So now short Tom, triazolam, notice lam, oxazepam, notice Pam, and midazolam. You guys may have heard of midazolam by the trade name Versed. These have a very fast onset, very short half-life. Short Tom, TOM, triazolam, oxazepam, midazolam. Medium cat, these are the intermediate benzodiazepines. Clonazepam, alprazolam, that's one that goes by Xanax. Lorazepam, whose trade name is Ativan. That's the more popular name for lorazepam. And then temazepam, medium cat. Those are intermediate acting benzodiazepines. Long divorce, DVC. Flurazepam goes by Delmain. Diazepam goes by Valium, and chlorodiazepoxide, Librium, goes by C, so long divorce. Those are the long-acting benzodiazepines. Short Tom, medium cat, long divorce. Katie Holmes and Tom Cruise's divorce. What are they used for? They're used for anxiety, for seizures, for the treatment of the symptoms of alcohol withdrawal, for panic attacks, for insomnia, and to calm people down before procedures if they're nervous. These drugs also will cause anterograde amnesia, so they'll forget the procedure as well. They can be very useful for that. They're given by mouth, IV, IM, or even as suppositories rectally. These drugs also potentiate the GABA A receptor. They don't cause it to open longer like the barbiturates. Instead, they cause it to open more often. Chloride ions flood into the neurons, hyperpolarize them, and prevent them from being stimulated. They are CNS depressants. Unlike barbiturates, benzodiazepines require the presence of GABA in order to act. So they are CNS depressants. Nursing responsibilities, remember the mnemonic benzo. Benzo. So B is for Beer's List. Beer's List. Beer's List is found online. It's a list of drugs that older patients should either avoid or be given with great caution. Older patients will be subject to the toxicities of these drugs more acutely. So elderly patients watch for falls and injuries. E, ethanol, opioids, other CNS depressants should be avoided when taking a benzodiazepine. N, not recommended for long use, since long-term use increases the risk of addiction and dependence. Z, sleepy. These drugs induce sleep. They're highly sedating. Therefore, avoid activities that require focus, like driving, making important decisions, or operating heavy machinery, or doing something that requires a lot of concentration. O, overdose. The antidote is the drug flumazenil. Flumazenil is on hand at every hospital. Use this drug when its benefits outweigh the risks. Other times, if the intoxication is not very severe, you can just wait for the drug to go through their system. Signs of benzodiazepine toxicity. Remember the mnemonic abused. Abused. A, altered mental state. The patient will be confused, slurred speech, and they're not themselves. B, bradycardia. Low heart rate. U, uncoordinated. They'll have ataxia. S, speech is garbled or slurred. That's very common. E, they will experience hallucinations or even memory loss. And then D, decreased respirations. These drugs, like barbiturates, can induce tolerance. So patients may take more and more of the drug and cause an accidental overdose. So again, older patients in particular are at risk for falls. Make sure the bed's not too high and put that belt on them and keep them from falling. And those, dear friends, are the barbiturates and the benzodiazepines. And where'd my mouse go?